First of all, does the etiology varies from region to region? I would say yes. There are certain factors that etiology is different in different geographical areas. Like in northern part of India, Punjab, and certain surrounding states, we had kind of endemicity of hepatitis is also very common in those areas. There are certain states where NASH or fatty liver disease is very common. So it all depends on multiple factors. There are a lot of studies happening on that. But yes, geographically it varies from one place to another. Chronic liver disease means liver cirrhosis, where liver gets damaged very slow over a period of time. So there are two very common reasons in adult population in India. I think the foremost reason is alcoholic liver disease, for which we do liver transplant, and second reason is fatty liver disease, which is called as NASH or NAFLD, where the fat gets deposited in liver and slowly damages the liver. I think in the recent coming times, fatty liver disease would be the biggest concern for India and many other countries. By one estimate, about 30 to 40% of adult population of any country is suffering from fatty liver disease. These patients will definitely land up in what is called as chronic liver disease or liver cirrhosis, requiring various kind of treatments, including liver transplantation. Now, need in India is about 50,000 liver transplants every year. That's according to the population and disease estimate. Now, we are doing only 2,000 liver transplants in India per year. So, why we are doing so less? Because the non-availability of brain dead donors. It's very important. Now, to know this, to put it into perspective, we should have by one data per million population, donors per million population is about 0.2 in India. And in few countries like US or Europe, this is about more than 30 per million. So there is a huge gap of donation in India as compared to other developed countries. I think recently we heard our beloved Prime Minister Ms. Modi also speak about, it was a big message to everybody that we should come forward for organ donation after brain death. It's not helpful only to few people. Once it is adopted on a scale of country, then this will save a lot of lives. First of all, let's talk about diseased donor liver transplant. In a diseased donor liver transplant, the donor liver, the liver source of liver, is a person who is already brain dead. Now, there are various kinds of deaths like cardiac death and brain death. Usually we accept donors who have brain death but heart is still working. So in such kind of donors, we have a window of 24, 48, 72 hours for organ donation. So internal organs are donated after brain death. This is one type of transplant. The second type of transplant is living donor transplant. In living donor transplant, a living person, whether it is a relative, a near relative or a distant relative of the patient, can donate part of their liver or any other organ to the patient to save their life. So living donor versus dead donor. So when we talk about diseased donor liver transplant or dead donor or brain dead donor liver transplant, it is a kind of a national effort, which means that any patient who is brain dead in any hospital, their relatives will consent to donate the organs to the country, and those organs are then allocated by different societies. One of them is NOTO, to the people who are in the list of recipients. So this is deceased donor liver transplant. Now, talking about the results and outcome of these two kinds of transplants, it's not very different. I would say living donor liver transplant is more planned surgery. Livers which are chosen are healthier livers because donors are healthier. As I explained to you that what is liver transplant, in which the source of donor organ is somebody else, whether it is a relative or a brain dead person. In auto liver transplant, the source of that organ is person or patient himself. To explain it in simple terms, suppose we plan an auto transplant in a patient, we completely remove the liver from the body of the patient. On the back table, we put that liver in some preservative solutions to preserve the liver, then remove the diseased part of it, and whatever remains, whatever healthy part remains, we change that part, we modify that part by putting certain blood vessels, veins, or artificial grafts, and then place that part again in the patient itself. So the source of liver is the patient himself. The healthier part of the liver is again placed in the patient's body. So this process is called as auto transplant or auto liver transplant. So this is a way from the body of a normal individual or from the patient, and but the condition is the remaining 30% of the liver should be healthy enough to sustain the life. So suppose for an example, suppose a patient has 1 kg of liver. An adult usually has 1 to 1.5 kilo of liver. Suppose patient has 1 kg of liver and leave 300 grams in the body itself. This 300 grams of liver will grow with time, and usually it grows maximum in initial 4 to 8 weeks time and reaches up to 90% of its size, but growth continues till 1 year. There are a lot of studies which say that we need at least 30% of our healthy liver. So we can safely remove about 70% of the liver from the body of a normal individual or from the patient. But the condition is the remaining 30% of the liver should be healthy enough to sustain the life. Suppose you divide a football into 2 halves and throw 1 half away, the other half will not become a complete football. It will grow in size itself, it will become a bigger half. So that's how the liver grows. So this is a very intriguing and very important question. So we just need to know something historical about this concept. The first liver transplant, I would say successful liver transplant, was done in USA by Thomas Starzl, who is considered as father of liver transplant in 1963. After that, those transplants were disease donor liver transplants. Now, living donor liver transplant was incepted in 1990s, which is a recent science, about 30 years old. In India, we did first transplant somewhere around 2000. And last 20 years, we have seen a mushrooming of liver transplant centers in India. It has gone up by, now we have around 250 to 300 liver transplant centers in India, right? So initially the number of transplants were, I would say, in last 20 years, that a lot of changes have happened. Technology has advanced. Experience has grown tremendously. Plus, a lot of instruments and equipments which we import, and now there are certain indigenous companies also which are making those instruments and equipments. Now at present, India is being looked at destination of choice for liver transplant. So as I told you that in last 20 years there have been a lot of advancements in techniques. There has been lots of advancements in experience regarding the outcome of liver transplantation. At present, India is being considered as the destination of choice for medical tourism for patients who need liver transplantation. Now we are sitting at very good outcomes after liver transplant, which is comparable to the best in the world. We have in Fortis about 98% success rate after liver transplantation. So robotic and laparoscopic surgery are combined together, classified as minimal access surgeries or scarless surgeries. It's not about robot or laparoscopic surgery, it is about a scarless surgery, which we do through keyholes. Recently, in last 2 3 years, we personally have taken interest in liver surgery by minimal access surgery. By minimal access, there are two techniques. I would say by laparoscopy or by robotic surgery. We do both. Now, in fact, we are the now India's largest center to do laparoscopic donor hepatectomy, pure laparoscopic donor hepatectomy. We have done more than 200 pure laparoscopic donor hepatectomies in India, the largest experience in India, as well as one of the largest in the world. The only centers ahead of us in doing laparoscopic surgery are Korean centers. But yes, I would say donor surgery or liver surgery as such, now the expertise have been there to do them minimally with minimal access or robotic surgery. So we are developing it further, but now we are very comfortable in doing such surgeries with robot or minimal access. Right now, if we take all the liver transplants, fatty liver disease is the second most common reason for liver transplant after alcoholic liver disease. And it is competing, and by one estimate, it will surpass alcoholic liver disease as a reason for liver transplant very soon. Now, why is it so? Now, we must understand what is fatty liver disease. In a fatty liver disease, the toxic fat globules get deposited in our liver. Now, these fat globules which get deposited in our liver, they are toxic to hepatocytes or liver cells. Slowly and slowly, what happens? They keep on damaging the liver cells. And it takes about 10 to 20 years, on an average 15 years, for liver to get completely damaged with these fat globules. They are not less than alcohol. So, this is a lifestyle disease. Now let's see what is the estimate of this disease in India. In India, about 40% of patients or adult people, healthy adult people like you and me, are suffering from fatty liver disease. Now, 10% of these, just take an example, out of 100 crores, 40 crores are suffering from fatty liver disease. And out of this, if we take 10%, 10% will go on to have some kind of chronic liver disease, means 4 crores in a year. And out of them, 10% would need liver transplant, means 4 lakhs. So this is tremendous. This is going to be an epidemic or pandemic in India, not only in India, all over the world. And we can easily prevent this because it is a lifestyle disease. Now, to prevent this, there are 2 or 3 things everybody should do. Number one, first thing first, go and check your liver with ultrasound and liver function tests. If everything is normal, no need to worry, just maintain your healthy lifestyle. But if something is abnormal, like you have a fatty liver disease, grade 1, 2 or 3, or liver function tests are deranged, and you are diagnosed to be a fatty liver disease, then we just need to remodulate our lifestyle. We need to decrease weight, have some supplements. With this, 90% of fatty liver disease will be reversed. So let's be healthy. Let's promote health of liver on this liver day. I think treatment is one part of it. The most important is prevention of the disease. In any World Day, whether it's a World Liver Day or World Heart Day, we should concentrate and focus and make people aware of health of that organ. On World Liver Day, I just want to promote healthy liver habits and healthy lifestyle habits.